So you've had your body toning surgery, be it tummy tuck, be it breast enhancement, be it brachioplasty, but you're really not sure how to manage your wound. I'm Zainab, I'm the pharmacist from PillSorted, and in this video I'll explain step by step what are the different dressings that you can use to support your wound and what are the things that you need to look out for. Okay, so the key important fact that I want to talk about is that although the first couple of days are really important about wound management, healing is a long and gradual process. So it's not just the scar that needs to heal. Inside, your body is doing a huge major recovery. It's helping fluid get reabsorbed. It's help your different tissues adhere and stick together. So it takes time. Be patient and be gentle with yourself. Why are the dressings so important? There's so many different kinds of dressings that can support different stages of a wound healing. And the reason that each of them is important at each step is if we do it wrong, we're not giving the right environment for the wound to heal properly. And if a wound heals properly, you'll have less scar, you'll have a lot less complications. So the healing will be much faster and much better. So that's why the wound dressings are so important. How do we want to do it? Generally, the first couple of days, what we need is the first layer that hits your raw wound has to be a non-adherent. What we mean by non-adherent is it doesn't stick to your wound. And when it doesn't stick to your wound, it can easily be gently changed. So another one put in. It's the important one for the first stage so that you don't want to disrupt that gentle recovery that's happening. And examples of that are this one. Some of them will have antibiotics like silver. So Ag counts for silver. What these do is they create this gentle protective mesh that will help the skin layers stick together and start creating the first layer of skin. And if it's got an antibiotic element into it, it'll help it keep away from infections. The next layer that comes onto this gentle first layer is a layer that'll be like a foam. So what those do is they take the extra fluid, but they will keep the wound moist. Not letting the wound dry is really, really important. There's a lot of evidence that when you keep a wound moist, you are letting the wound heal faster and better, okay? And one thing that we want to avoid is scabs forming. So if it dries in scabs and the scabs get cut off, it'll start re-bleeding, regenerating the whole wound. So that's why keeping it moist is super important. And things like this. So this is a foam dressing. And then on top of this, you will have something like a film dressing. Film dressings are see-through, and the good thing is you can visually see the wound and it helps keep it clean. And sometimes it's used to keep the other ones in place. But generally this would be the three different layers. So the softest and the kindest non-adherence closest to the wound, so just creating that protective mesh layer. Then you've got something that can protect from extra fluids like the foam layers, and then you've got the tegaderms on top, so the film layers. This would be the first set. Then depending on where the wound is and how much more protection it needs, it can be different things. So for example, for a tummy tuck, if you're wearing a compression garment, compression garments are so important, especially when you've had the breast enhancements, when you've had the tummy tucks, because they help your body keep the new form that it needs to have, plus avoid too much inflammation, too much fluids getting into that area. So make sure that you keep those compression garments on. But if, for example, they're putting pressure on where your surgery is, there are extra pads. So this is like a pressure reducing pad. It can be worn at different parts of the body to avoid extra pressure. So if there's somewhere that's getting friction too much, again, these pads are really good. The first couple of weeks would be probably these, but again, it depends on how the wound is healing, how the scar is getting improved, but you do need a follow-up check on them. So the next stage after that would be dressings like hydrochloride. Duoderm is a sample of a hydrochloride dressing. Is absorbent and it is airtight. So what it means is it creates this healing environment, and it's got like this gel forming agent in it. And what it does, it takes again the extra fluid, but it keeps it a moist environment for the wound to heal. And the good thing is when you want to take a shower, these are the things that you want to go after, the hydrocolloid dressings, so that you can take a shower easily. Showers are fine, usually 24 to 48 hours after the surgery, but you don't want to soak your wound for a long time after. So at least a good couple of weeks, 6 to 8 weeks after. Don't think about bath or swimming pool, because you want to keep it as dry as possible. And then when there's less oozing and less discharge from your wound, then you can move on to lighter dressings like this. There's so many different sizes of these. If you're not sure or if you need more, just feel free to reach out to us and we can help you find the right dressings. But as you say, this has got a good size to cover a lot of the surgery, especially for example for the arms. That should be fine. But if you can't find the specific size that you're looking for, you can make some yourself using different things. So for example, this Cosmocore, you can put as many of these as you need, and then you can cover it with bandage like this. Good thing about the bandages and this is you can make it as big and as comfortable as you want, and then they can easily stick to itself with like these Clinipour surgical tapes. So these surgical tapes, you can stick it to your body itself as well. So for example, if you've got a tummy tuck scar, you can put all of the Mepors that you want, whatever size that you want, and then stick it with the tape and then go with the bandage all around, so it avoids having niggly parts on the either sides of your body. Okay, and then for protection, there's extra layers as well. These 2B grips are really good for arm. And in terms of what to wear, we've discussed about the compression garments. They're so important to wear them. Once you feel that the scar is getting better and you're generally feeling better overall, wear light and loose clothes so you don't bring added pressure onto your surgery, okay? Because the healing still takes time from inside. So if you wear too tight too fast, you're pulling the wound away from each other. Now for long term, the one that has got the most evidence-based support for reducing the scar and getting the scar improved is silicone. So you can start using silicone as soon as the wound is completely closed. Usually it takes about 4 weeks for the wound to be completely closed, but after that, start using the silicone and carry on using it for a year. There's no upper limit for how long to use a scar, but it genuinely affects and improves the scar visual much more than anything else. Again, be gentle with yourself. Scar management takes a lot of time. What are the practical wound care tips that you need to be mindful of at home? First, keep it clean. Make sure your hands are clean. Make sure that you keep all the wound dressing and everywhere somewhere clean. If you need to clean the wound a little bit, so you see a tiny little bit of discharge from it, use something like these sterile salines. Use these as often as you want. They're really good. They don't irritate your skin. They help keep it clean. I don't want you to use too much of an antibiotic cream unless you've been prescribed to do so, because it does slow down the healing a little bit, okay? And the other thing is you want to pat dry your wound. Don't wipe it. That can make it really, really painful. Okay, so just pat dry it. The third one is make sure that you know about the dressings, what stage your wound is right now. So ask your doctor, ask your surgeon, ask the nurse, what have they used so far? What would be the best thing for you to use moving on? And the third one is actually look at your wound every day. Inspecting it is really, really important, because if you see any signs of oozing, yellow, redness, or even if it starts getting a little bit smelly, these can all be signs of infection. And infection on a scar is not a superficial infection. It can go all the way to the surgery site, which can affect, all of your body and organs. So be careful, look out for it, and check it visually. If you're on your weight loss journey on the GLP injections, the thing that I want you to be mindful of is you will see a change in your appetite. It's just because your body needs to recover. So for healing, it needs to burn a lot more calories. It's okay. Don't rush to go back onto your GLP treatments because your body needs to get that nutrient. So you can go back onto it, but give yourself time and make sure that you put in a lot of the nutrients that'll support wound healing. Things like collagen is really important, vitamin C, zinc, a general multivitamin and mineral that will make sure that you've got the baseline of majority of the nutrients That's really important as well. What do you need to look out for? Other than the things that I talked about already about, having a discharge or discoloration, there might be things like wound opening. So if an extra pressure comes onto the wound, it might make the two sides of the wound tear apart from each other. That'll bring a lot of pain. You do need to make sure that you go back to the surgeons, get it checked. If you get any pain or swelling around the surgery site, around the wound, or in your legs, they need more attention. Also, that if you see the discharge from your wounds are getting more instead of going less and going towards clearing discharge, that's again is something that needs more attention and you need to get it checked. Okay, so as a recap, there are so many different good options for wound healing. Take it seriously. The more and better you protect your wound, the less of a scar you'll have moving forward. This video is part of our travel health series. Feel free to subscribe to our channel and visit our website for that clinician-led health advice. Thank you.